Hello, I'm visiting with Dr. Hajal at the Sleep Center. Let's talk about children, Dr. Hajal. What kind of problems do they have for sleep?
It all depends. Children can have many problems of sleep.
They
Some,
can.
some are part of the normal growing up process, and other would be signs of disease. Like for instance, sleepwalking and sleep talking in children is very, very common.
Is it?
And you have, before the puberty age, you have many children who would walk around, wander around the house, and those are frequently very benign episodes, but sometimes they could manifest also, it could be a manifestation of seizures, and that's why it is
Oh,
important to
okay.
get a sleep evaluation for the child. In addition, you can have sleeplessness, which is the child form of insomnia, and you can also have a lot of sleep apnea issues in children as well. Part of the childhood, you have the adenoids and the tonsils that
Oh.
are big, and then they start snoring, and I frequently say